My name is Tamer Rabie, and I serve as the Global Program Lead for Climate and Health within the Health, Nutrition and Population Global Practice at the World Bank Group. I'm also a member of the NAM Commission on Reimagining Systems for a Healthier Climate Future, and it's such a privilege to be here with you today and to moderate this timely and essential conversation. We've just concluded a very rich and thought-provoking discussion on value, how we define it, how we measure it, and ultimately, how we make it matter. The previous panel made it clear that for climate and health action to truly scale, its value must be made visible, not only in moral or scientific terms, but also economically, operationally, and financially. It's encouraging to see our conversation shift toward practical changes in our economic systems. From my vantage point at the World Bank, we are deeply committed to working with partners to identify concrete actions that leverage the capacities of national and subnational governments, the private sector, civil society, and others. Our goal is to drive momentum in prioritizing health within climate-based solutions. Now that we've explored how to rethink economic value in climate and health action, the next critical question arises. Once we have redefined what matters, how do we finance it? How do we move from aspiration to allocation, from promise to provision? While the science is clear and many solutions are well known, they remain chronically underfunded, especially in the communities that bear the greatest climate health burdens. At the World Bank, we recognize that financing climate health solutions must match the scale of the global climate crisis. Just last week, I was in Brasilia for the Global Conference on Climate and Health to discuss the Belém Health Action Plan, which outlines a broad range of actions with a strong focus on adaptation. The conference provided an opportunity to engage with governments and partners, including the private sector, on mechanisms to maximize finance for climate and health action. These discussions reinforced the significant opportunity for the plan to include a dedicated action line on financing for climate and health. Importantly, we emphasized the need to understand specific country-level needs to ensure that resources are targeted where they're most urgently required. We also explored a range of financial instruments and innovative solutions, such as blended finance, which could open new possibilities for resource mobilization. Crucially, this is not just about increasing funding. The real priority is to ensure that financing supports impactful solutions at the scale and pace required to address the challenges that countries are facing, especially given the fiscal realities confronting many of those countries. As we look ahead to COP30, many stakeholders and partners are asking, what will it take to create the enabling conditions and build the capacities needed to deliver on financing these solutions? This will require us to redefine the financing landscape, not only by mobilizing resources from traditional health financiers, but also by catalyzing support from climate financiers and the private sector. Traditional funding models are no longer sufficient, and in some cases, they are no longer viable. We're compelled by necessity to rethink the status quo. If we continue to rely on the same financial flows, we simply will not achieve the scale or speed that this moment demands. That means reimagining the financial architecture itself. What kind of instruments, institutions, and investment vehicles can operationalize a new investment logic? How do we blend, stack, and scale capital in ways that reflect both climate urgency and health equity? And most importantly, how do we ensure that countries, especially those on the front lines, have the fiscal space and financing tools they need to lead? In this session, we will hear perspectives from across the capital stack, from public finance and fiscal policy to philanthropy, private equity, and global capital markets. We will ask, how can these stakeholders work together, strategically and coherently, to finance what truly matters? Well, to get us started, I'm delighted to welcome Martin Edlund, Executive Director of the Health Finance Coalition. Martin will ground our discussion with a clear-eyed view of the climate health financing landscape, where the needs are greatest, where capital is falling short, and where promising models are beginning to take shape. Martin, over to you.
Thanks very much, Tamer. Great to be with everyone. Greetings from Jakarta, where it is almost 10 at night. So sorry if my voice is a little frayed here at the end of the day. As Tamer mentioned, I'm the Executive Director of the Health Finance Coalition. I've been working closely with a number of the leading financing institutions focused on climate and health, including working closely with Tamer and his colleagues at the World Bank. We helped the Global Fund to set up its new Climate and Health Catalytic Fund. We've just helped the Asian Development Bank launch a new initiative that they call Excited. It's a long acronym. I can never remember all the letters, but it's essentially about scaling innovations for climate-sensitive disease across 22 countries in Asia and the Pacific. And we're actually in train helping the Inter-American Development Bank develop a similar initiative. So what I hope to be able to do today is start by framing kind of where we are in terms of climate and health financing, where we need to be, where we're falling short, and then to kind of double click into a real practitioner's eye view of how this is working, how we're supporting countries and institutions to try to close these gaps. So just to set a little bit of the context, and this is well known to many on this call. Of course, we're facing new challenges that put the health and livelihoods of half the planet, 4 billion people, at risk. These include disruptions to the donor model that has driven growth in health financing for the last 25 years. Of course, increased pandemic risk and climate change as a major cost and factor in health risk. But so that we don't spend our whole time doom scrolling, I want to be quick to say that this is also a moment of real optimism. There are better solutions coming to address many of the risks presented by climate change to health. And I'll focus on one example of that as we get into the conversation a bit more. And as Tamer said, we need a new financing model. We need new ways of thinking about how we bring sources of capital together, working in concert to achieve countries' health goals and protect the health of their populations from the risks of climate change. So, as many of you have probably seen, at COP29 last year, the World Bank launched a report called The Cost of Inaction. That analyzed the human and economic costs of climate impacts on health across low and middle income countries with national populations exceeding 10 million people. The results of this were startling. I think it's important that people were startled by these numbers. The study found that between now and 2050, climate impacts on health would cost up to $20.8 trillion, translating to between 0.7% and 1.3% of GDP among low and middle income countries. That climate change would cause up to 5.2 billion cases of climate-driven disease over that time, and that climate's impacts on health would kill an additional 15.6 million people. As startling as those numbers are, they become even more dramatic when you consider the fine print, that this study only looked at 5 areas of health: dengue, diarrhea, extreme heat, malaria, and stunting. And so all of those impacts we talk, those huge numbers that I just mentioned, come from only those 5 impacts of health, and of course, of climate on health. And of course, they're much broader impacts. On this slide, I was highlighting some of the impacts as they relate to Asia Pacific. I was presenting this at the ADB's recent Inspire Health Conference in Manila. And, it's worth pointing out that this is the area most impacted in the study. And in South Asia, for instance, 3% of GDP loss could be attributed to climate's impacts on health. So surely the cost of inaction this dramatic should spur action and adequate funding for climate health adaptation, right? Well, we'll see. The good news, of course, is that climate financing has more than doubled in the past 3 years. Estimates are that in 2024, spending topped $2 trillion for the first time. So we are seeing the world step up and put more money to the risks associated with climate change. But as steep as that curve is that we just looked at, it's only a small part of what we'll need. The estimates are that it'll need to grow almost 5x again to reach the almost $9 trillion per year required to avoid the worst impacts of climate change by 2030. So, we've seen substantial growth, but we've got to see that growth continue or even accelerate in order to meet those targets. Now, this is a slide that I would never encourage anyone to use in a presentation such as this because it's so unwieldy and impossible to interpret. But helpfully, I circled the part that I wanted to highlight here. Of that $2 trillion per year in climate spending, total adaptation spending is just 65 billion. So the money that goes to try to address and prevent the worst impacts of climate change is only 65 billion. And of that, only 28 billion is public international financing that goes to low and middle income countries. This is about a tenth of the need estimated by the UN Environmental Program, which suggests we need about 280 billion per year just to address adaptation needs in low and middle income countries. So within that adaptation financing, what's the need for health? This has been a really difficult number to get our arms around. And I know Tamer and his colleagues have spent a lot of time on this as well. One of the numbers that's commonly cited is the UN Environmental Programme's Adaptation Gap Report from 2023, which actually broke out an estimated need for health adaptation for low and middle income countries. The estimate was a need of at least 11 billion per year for low and middle income countries now through 2030. We did some work with the Clinton Health Access Initiative. We looked at burden of disease and attribution of DALYs across low and middle income countries and came up with this estimate of the needs, the financial need per region and how it breaks down between some major health impacts of climate change, things like waterborne disease and diarrhea, dengue and malaria, some mosquito-borne disease, and you see the rest here. So keep that number in the back of your mind, about 11 billion per year estimated need for climate health adaptation spending in low and middle income countries. Even harder to get our arms around is what the actual spending is for climate and health adaptation needs. This is a study, this is a graphic from a study that people may be familiar with. Rockefeller Foundation commissioned Seek Development to estimate climate and health commitments by funder type over the last several years. You can look at this on the surface and say, well, the number's growing, and it's even approaching that 11 billion per year need that we talked about a minute ago. I have said this to Seek Development, so I am not shy in saying it here. I think this grossly overstates the commitments to climate and health from the sources you see here. The single largest source, the biggest growth that we see is from the Development Assistance Committee. This is OECD donor countries through their bilateral aid addressing climate and health needs. And this is really a problem of coding. Any grant that includes any portion of climate and health is coded and counted, the entire amount counted toward that goal. So it probably overstates dramatically, I think, the bilateral assistance for climate and health. Likewise, you see big growth, particularly in the most recent year, in multilateral health funds. By multilateral health funds, we mostly mean the Global Fund and Gavi, both of which do spend money on things like malaria and dengue and so forth. But they haven't increased their spending in those areas in recent years. They've just started to code it as a climate sensitive risk. So what we're likely seeing in large part here is people becoming sensitized to climate impacts on health and starting to count funding flows as addressing climate impacts on health rather than seeing incremental money that's needed in the system. The one that I think, well, the two that are I think more accurate, just based on the quality of data they were able to access, is spending by multilateral development banks, so MDBs, which has grown over the years. And I think if you were to extrapolate this out the next couple of years, you'd see even more dramatic growth. And we're starting to see more spending by multilateral climate funds. And what we really mean here is largely the Green Climate Fund, which has built a robust pipeline of health programs that they're now funding and actually funding in close coordination with partners like the Global Fund and the World Bank and a few others. So, if I had to kind of squint and eyeball this and say where I think we are, I think we're probably at between $3 and $4 billion per year spent to address the climate health adaptation needs. So if you cast your minds back to that first slide we looked at from the cost of inaction report, we're talking about estimated cost of inaction of $20 trillion between now and 2050. And we're spending between 3 and 4 billion a year annually to stop that. Such a tiny portion that it didn't even show up as a use of funds. Health didn't show up as a use of funds on this complicated slide that I showed a minute ago. And of course, even if you saw those numbers around bilateral assistance, the DAC number for health, and believe those, of course, the trend we're seeing is huge disruptions to donor aid for health. This is some graphics from a recent New York Times story, but you could pick from hundreds of stories that have been hand-wringing about changes in the donor landscape. Of course, with DOGE and the Trump administration, we saw substantial cuts to existing USAID programming. Of course, the dismantling of USAID and the programs that have survived taking shape now under the State Department. It's been hard to get our arms around exactly where those programs stand, but as a kind of mile marker, President Trump, in his budget request for FY26, requested a 65% decline in U.S. Global health spending, going from 10 billion a year to about 3.5 billion a year. And the U.S. is the single largest, of course, bilateral donor and contributor to most of the multilateral providers of health. So where does that leave us? It leaves us in a place where the climate impacts of health are, of course, becoming much more dramatic. These aren't theoretical. We're seeing them year in and year out. I'm here in Jakarta, as I mentioned, where they've seen dengue grow from 30,000 hospitalizations due to hemorrhagic fever from dengue in the year 2000 to last year, 289,000 hospitalizations. So huge, huge growth in these climate-sensitive infectious diseases. And so in order to address it, what we really need is a new financing approach, as Tamer alluded to in his introductory remarks. We need to coordinate spending between country budgets, concessional loans, commercial investment, and what I like to call catalytic grant capital. I call it catalytic because we're no longer in a place where we can stretch grant dollars. We need to multiply them. And the way that you multiply them is through using them as part of a capital stack, using them to de-risk and crowd in other forms of capital. I'll talk about a specific example of this in a minute, but broadly, we see 3 or 4 uses of catalytic capital that have this multiplier effect. Number one, you can do things like buy down the interest rate on loans, make loans more attractive for countries to use for their climate and health needs. You can do performance-based payments to reward effective programs. You can provide guarantees and, in other ways, de-risk more commercial forms of investment in things like manufacturing to address these needs. So we are starting to see a lot of these capital stack partners come to the table, and they're increasingly looking to coordinate their capital and play a bigger role. Here you see just a sampling of them. Of course, the World Bank is probably the single largest funder in this regard. It aims to spend about $2.7 billion, or 45% of its $6 billion in annual health spending at the intersection of climate and health needs. As I mentioned, the Asian Development Bank has just launched a new platform, the Excited platform, which has a target. It hopes to grow to $2 billion in funding for diseases like dengue, malaria, and enabling investments. We've already spoken about the Green Climate Fund and its support. We've had recent conversations with the Asian Infrastructure Investment Bank, which has a new health strategy which specifically highlights and targets climate impacts on human health. So we're seeing across the board a number of these players step up. I mentioned already the work that we're doing to support the Asian Development Bank and the Inter-American Development Bank to create these kind of structures to help countries to meet these needs. So often when you talk about blended finance, things get abstract and hand-wavy. And at the Health Finance Coalition, we like to get concrete. We like to talk about specific deals on the table. So that's where I want to go now. I want to talk about a specific issue area, technology, and an example of how these capital sources come together to address these needs. So the challenge I want to highlight is dengue. And as I've mentioned already, we've seen just explosive growth in dengue due to climate change and urbanization, tenfold increase in the last 8 years. The World Health Organization estimates between 400 million and 500 million cases globally and 4 billion people at risk. So that's the scope of the challenge. The hope, the good news is that there are finally transformative solutions that can address dengue. So being here in Indonesia, it seemed appropriate to highlight the randomized control trial that was done around a new, still relatively new mosquito technology called Wolbachia. That when released into the wild population, this is a naturally occurring bacteria that just shuts down mosquitoes' ability to transmit dengue and other arboviruses like yellow fever, chikungunya, and Zika. In this randomized control trial, which was done at the scale of a city of Yogyakarta, they saw a 77% reduction in dengue cases and an 86% reduction in hospitalizations. And this was published in the New England Journal of Medicine. With results like this, and there are about 14 countries that have now begun to scale Wolbachia, there's a push to try to bring this to scale to arrest and address that growing need for dengue that we described a minute ago. So in the past 15 years since Wolbachia was discovered, it's only protected about 14 million people. The goal is in the next 8 years to scale it to 1 billion people or more and try to reduce the global dengue burden by at least 25%. One of the ways that you have to do that is dramatically reduce the cost. So to date, it's cost between $20 and $50 per person. So if you were to try to get to 1 billion at $50 per person, that's a $50 billion problem. But through product innovations, manufacturing at scale, that price is coming down dramatically. And we think it's beginning to hit the WHO target price of between $3 and $4 per person. So I'm stealing this line from Tamer, who said it in a recent meeting we had, but we're turning a $50 billion problem into a $3 billion problem through those product innovations. So the reason I'm here in Indonesia is we're working with a group of partners led by the Ministry of Health and the University of Gadjah Mada and the Tahia Foundation to take the success they've seen first in Yogyakarta, then in a 5-city expansion, and scale that to 100 cities to protect more than 100 million people here in Indonesia. And so this is kind of the scale-up strategy, building local manufacturing, scaling to 5 additional demonstration cities, and then really seeing that ramp to scale over the next 6 to 7 years. What's most relevant for this conversation, though, is how do you finance that, right? Where does the money come from? How do you bring these different sources of capital working in conjunction to make a dramatic scale-up plan like that possible? And so this is the basic capital stack that we're looking at for what we're calling the 100-100 plan to scale to 100 or 110 million people here in Indonesia. So there's about 10 or 11% of what we'd call on-budget government spending. So this is the national and municipal governments covering a portion of these costs. It's essentially a substitution for the costs that they previously had for things like fogging and larvicide and so forth for dengue control. Then there's a big concessional loan from a partner like the Asian Development Bank, the Islamic Development Bank, the World Bank. And then there's a small sliver of commercial investment to build local manufacturing, to scale Wolbachia here and then to export to the region. But this entire kind of side of the capital stack is made possible and really enabled by this catalytic grant funding. So about 10% of the overall project need would come in the form of, free money, grant capital, to enable the rest. We think half of that can come from the traditional sources that you look to globally, and the other half can come from local leadership, corporate and philanthropic leadership here in Indonesia, given how dramatic dengue's impacts are on worker absenteeism, tourism, real estate value, et cetera. It's something that business leaders are keen to address. So as you think about the global sources of financing, you can think about global philanthropies, bilateral donors who have a longstanding interest in the region and in a country like Indonesia, and of course, working with multilateral donors and institutions. But where it really gets interesting is when you think about that local catalytic capital, the local corporate and philanthropic leaders who can address these needs. I threw this slide in this afternoon on my drive back from meeting with the Indonesia Business Council, who is really excited to take this on with us and build a platform where they can mobilize their membership, which includes the 35 biggest companies here in Indonesia, and the associated philanthropies to help provide that portion of the catalytic capital that can unlock the rest of the capital stack and make this 100-100 plan possible. And so when you think about the value proposition for those grant funders, they're no longer funding everything. There isn't enough resource for that. But for the local catalytic capital providers, they're getting a 20-to-1 return on their money, or 20-to-1 leverage in the money that they're able to mobilize by providing, about 5% of this overall financing. That was a lot of numbers and some hand waving, so hopefully that was clear, but I wanted to end by grounding us in a specific example. We do think this is a blueprint for how you can scale these innovations across the region and across the globe. I will say there's really strong interest in this technology, Wolbachia, as an example. We've met with neighboring Philippines, with Pakistan, Vietnam, Cambodia, a number of other countries who are looking to address their worsening dengue burden through these innovations. So there's strong demand from countries, but a real need to bring this level of sophistication and coordination to make this funding happen. Let me stop there. Thanks, Tamer.
Thank you, Martin. I mean, this was an excellent way to really kickstart this session and the discussion that we, will be following from what you've just presented. Just to remind everyone what we've heard, from Martin: 4 billion people at risk. The cost of inaction is just it's beyond belief. I mean, $21 trillion, as Martin, was referring to. I mean, this is quite substantial in terms of the global economy. And in fact, it's only the tip of the iceberg, as Martin, had highlighted. I mean, if we were to perhaps consider some other, let's say, impacts from mental health, air pollution related, climate impacts, those would be driving, these impacts far, far higher than what we're seeing. I think the main message that also came out from Martin's presentation today is that while climate finance has doubled, we're still not getting to the point that we need to be at. He left us with the number of the 11 billion per year, $11 billion that are needed per year in low and middle income countries for adaptation needs. And obviously, this is at a time where we do know that development assistance for health is shrinking. So solutions have to be developed, moving towards blended finance that also considers country concessional loans as well as commercial investments and catalytic grants is going to be extremely important. And it's beautiful that you all obviously put all of that in within this frame around Slovakia and how we could be scaling a particular solution up. But let's move actually in the next part of this session. We'd like to build on what we've heard from Martin, and I want to be able to turn to a number of distinguished panelists who each will bring a very different perspective from across the capital ecosystem on how their sector is approaching the challenge of mobilizing and directing capital for climate and health action. What's working, what's evolving, and what we need more of. So to start off, I'm pleased to welcome Sara Jane Ahmed. She's the founder and executive director of the Financial Futures Center and finance advisor to the V20 group of finance ministers. It's a coalition of 74 countries that are systematically vulnerable to climate change and working together to promote climate finance and resilient economic policies. Sara, let me pass it over to you for some reflections on what you've heard from Martin. Over to you.
Great. Thank you very much, Tamer, and thank you, Martin, for the presentation. So just to start, the Climate Vulnerable Forum and V20 is a group of 74 countries. Barbados is the current presidency. And what's interesting about this year in particular is there's now a science and health agenda in this coalition of countries just because of what we're seeing in terms of trends and climate impacts. In terms of the funding side, I mean, climate vulnerable countries have high levels of debt servicing costs, but also lacking fiscal space and high cost of capital. So when it comes to mobilizing capital for climate adaptation and health resilience, loan tenors of up to 40 or 50 years are essential. And we see that MDBs from the presentation can play a significant role. But we're seeing, for example, in particular in the International Bank for Reconstruction and Development, IBRD at the World Bank, there is a fundamental trade-off there between preserving capital to expand its balance sheet and offering affordable instruments for climate and health investments. So this tension is something that needs to be solved, and lending at rates above a country's medium-term growth potential reduces development impact and does compound vulnerability. The agreement that we saw in Financing for Development Summit, FFD4, in Spain some months ago now, is encouraging in terms of seeing that it calls for a tripling of MDB lending capacity. And so hopefully that we have that commitment along with instruments that are aligned with the long-term resilience needs such as health. So I just want to put a little bit more in perspective the debt issues of the CVF and the V20. So the cumulative debt is 746 billion, and this is just for debt servicing payments and IMF repurchases and charges. And so this is really putting pressure on balance of payments and the government's abilities to spend on social development, health, climate priorities as well. And so what we're seeing is extending debt repayment terms to 40 years could cut payments by $267 billion. This is big. This is good for fiscal space. And if interest rates were lowered to 1.3%, the savings could be around $454 billion. It's a 37% reduction. What's also clear is that fiscal space isn't just a budget line, it's also a resource, and that it can grow with smart investments and also reduce with poor choices. And so hopefully as we see high growth opportunities, high impact opportunities, this is something where government and maybe domestic private capital can participate. Something else I'd like to highlight is the global goal on adaptation. The indicators perhaps could be used as outcome indicators to help with structuring, perhaps impact financing around health climate and health investments, perhaps to consider these low-tech and high-impact opportunities. With that, I'll stop there as I don't want to take any more time. Thank you.
No, thank you, Sara, and thanks actually for obviously, putting emphasis on the fiscal realities that countries are facing. And of course, big parts, as you've mentioned, will be in thinking about solutions of how to assist those countries really navigate those fiscal realities in relation, obviously, to debts. But it also links back to the work that Martin was speaking about, which is how do we then think in a much more broader sense of bringing in, if you will, the full capital stack that includes, obviously, not just the government resources, concessional finance, but also impact investments and potentially also catalytic funding coming into this. So with that, I'm going to turn actually to our next speaker, Jessica Brown. She's the Senior Director for Adaptation and Resilience at ClimateWorks Foundation. Jessica will be reflecting on how philanthropic capital is evolving to support integrated climate health strategies and systems level impact. Jessica, the floor is yours.
Hi there. Thanks so much for having me. Really, really great to be part of this discussion, and really appreciate some of the framing that Martin presented, which I think teased me up well for my short remarks about the role of philanthropy as hopefully a catalytic player in this space. I'm with ClimateWorks Foundation. We're a philanthropic organization focused on climate change. Historically, most philanthropic funding, as we're seeing from some of the numbers Martin put forward, has really been focused on climate mitigation, on reducing greenhouse gas emissions from entering the atmosphere. But given the current political reality, we know that we are exceeding the carbon budget. And so there is a growth in the amount of funding going towards addressing the climate impacts. And particularly now we are helping a number of different foundations really focus on the intersection of climate and health. And in particular, one of the topics that was mentioned as a real health threat is extreme heat. So right now I'm working to establish a fund called the Adaptation Resilience Fund. It will address multiple climate impacts to help build resilience with a focus in lower and lower middle income countries. But the initial focus we're taking is on extreme heat and the intersection with health, as well as on labor. We also work with a number of different foundations through the Adaptation Resilience Collaborative to help increase the overall focus and investment coming from philanthropy into this space. As Martin mentioned, adaptation does remain one of the most underfunded areas of climate action. Public finance is covering perhaps less than 10% of adaptation costs. There's been a number of studies that show the significant returns that we can see both financially and in terms of health outcomes if we increase investment in adaptation resilience. Just some specific things that we are looking to support. Again, philanthropy's role, we are always going to be a very small funder from a kind of scale perspective, but our role really is meant to be catalytic. We like to leverage and de-risk other forms of investment. We like to pilot new things. We like to uncover important research and data to help move the field forward. So some of the things that we are supporting through our fund, but also philanthropy writ large, that does help address some of the health concerns are things like climate information systems, early warning systems, so folks know when climate impacts are coming and can be more prepared. We're also supporting organizations that are working with local governments to provide solutions. Again, our focus right now is really on extreme heat. So this is things like labor protections, access to water, access to cooling stations, things like that. We're also supporting different piloting approaches with parametric insurance, which is essentially a trigger-based approach to insurance. So if the temperature exceeds a certain threshold, folks can receive a direct financial payout instead of having to go to work. This is a really important financial solution, especially for those in the informal labor market, in the informal sector of the economy, who do not have other forms of labor protections available. And also, we are experimenting with different forms of social protection for those who are on the move because of climate change. We know that folks are going to be increasingly forced to move either permanently or seasonally due to the effects of climate change, due to drought, due to flooding, et cetera. So how can we ensure that those who are moving do have the social protections and the health protections that are needed to ensure that they can thrive and be productive? We are also trying to work with different forms of investors, whether it's institutional investors, public sector investors, multilateral investors, to invest in resilience as a starting point to prevent some of the negative health outcomes that we are likely to see and really avoid the costs once certain extreme climate hazards do hit. So I think I'll wrap up the remarks by just saying I do think, philanthropy plays a really, really critical role in addressing some of the issues and getting ahead, trying to advance some of the systemic and transformational outcomes that we seek instead of just addressing them once we see some negative health impacts. And very keen to work across different financial actors and across the spectrum, because it's really when I think our capital comes together that we can be most impactful. So thanks so much.
Thank you, Jessica, and thanks so much for also bringing up a number of examples of what you're doing, through a philanthropic lens. I want to actually link it back to one sort of, point that was made in the previous session where, Boone mentioned from Temasek Foundation that we need to move from proof of concept to proof of value. And I believe that, that's in essence what you're obviously doing through, coming from a philanthropic sort of, standpoint, thinking about de-risking of investments, thinking about, sort of how we increase investment returns. Obviously, I think all of these are important, obviously, issues that one needs to be able to take into account. So thanks again, Jessica, for those remarks. Now, from philanthropy, we're moving over to and returning to the private sector with Nancy Pfund. She's the founder and managing director of DBL Partners, a US-based venture capital firm that aims to advance positive social, environmental, and economic impact through investments in clean tech, healthcare, sustainable products, and more. Nancy, over to you.
Thank you very much. Just really enjoying the presentations and looking forward to our dialogue. So DBL has been an impact venture capital firm since for over 20 years. We're one of the original firms to invest in solutions to climate issues and social issues, and the venture capital model is obviously you start with things that are very tiny, small, no one knows about, and you hope to grow those and have significant impact. And so we've been fortunate to be able to do that throughout our 20 years. I want to focus on, for the purposes of this discussion, an investment that we have made about 8 or 9 years ago that has really been a labor of love and is now coming together in a way that very significantly addresses some of the financing opportunities that we now see available to scale climate and health solutions. And at DBL, we've always seen climate and health investing as two sides of the same coin. They're so intricately linked. So let me just tell you about Zola. Zola is a company that started in the off-grid solar market in Tanzania and still has that as a very thriving business. It's one of the larger off-grid suppliers. We decided to invest in technology because the off-grid market, while high impact, is a little difficult to scale on a market rate approach. And so when we saw a screaming need for software, storage, battery systems, inverters to address the issue of the weak grid in many parts of Africa. the unreliability of energy supply and what that does to society and specifically to healthcare in this example. So we spent many years developing a battery energy systems power system that allows you to go back and forth from your solar to the grid seamlessly, no need for diesel generators. And so what that was the technological innovation. What we have been working on now is the financing innovation. And what Zola has done is to combine a public-private partnership approach. We've relied on development finance, venture capital, grants over the years, so that public-private partnership is key. But then we've also changed from selling products to selling service. Energy as a service is really a key unlock here, because when you sell a service as opposed to a product where you're one and done, you are embedded in the community. You are helping whoever it is that is your customer to thrive, and you are part of the maintenance, the continuing of access, the continuity of care, if you will. And so those two approaches together have created an opportunity for unlocking scale. So what Zola did with USAID and Bechtel has a .org. Bechtel is obviously a large international construction and engineering firm. They have a .org that takes on smaller projects and ones that have a lot of mission, but it's very buttoned up and runs very professionally. It's actually a training ground for high potential Bechtel employees to work in the .org projects alongside of their base business. So we started a program whereby we, with Bechtel and the USAID and Zola's technology, we delivered these energy systems to over 500 health clinics and pharmacies in Tanzania. Many of these facilities suffered from intermittent or unreliable grid access, which threatened the safe delivery of care for the patients, and also reduce the quality of the medical products that were being used. Even things as simple as lighting around pharmacies so that people could go there when it was dark and after work, for example. Lots of issues when you're not, when you have grid access problems. So we combined the donor support from USAID with the venture-backed Zola and a service-based OEM, in this case, Bechtel, to ensure that the system stayed operational long after the initial investment, and developed a continuous energy as a service model whereby we get paid as the system is used. So what made this successful wasn't just that we were installing batteries or solar, it was the structure behind it. The switch from selling equipment to delivering energy as a service is handling installation, maintenance, performance monitoring, even adjusting the system for optimizing the energy production. All of that really helped to increase performance from the start. So I know you're all wondering what happened when USAID disappeared from the scene. And so this is where a lot of the magic starts. And if you'd like, you can move to the second slide. What happened is that because these clinics were so embedded in their communities, so much a part of an overall infrastructure, not just for energy, but for payments, for customer support, for qualifying loans and such for the customers, that when we lost USAID, I mean, we still had Zola, we still had Bechtel wanting to do this, we we caught the attention of a African-based corporate player to step in and continue this process. And they did that because they recognized the value of the technology infrastructure that had been built and how it fit into their overall business across Africa. And so they wanted to expand with this reliable energy as a service model because it was synergistic with their overall technology and financing infrastructure. And so that company is EcoNet, which is led by Strive Massayiwa, and is operational in many countries of Africa. And so we are going, and this is all real time. I'm sure we'll encounter hiccups as we go along. But the goal here is to spread this Tanzania 500 clinics to 10 countries over the African continent and build this energy as a service model. And so this is great news for investors because it's scaling, it's developing a company that's really going to create value for the investors. But obviously, from an impact point of view, it's great news for the ability of communities across Africa to have access to clinics in a way that is enduring and community-based, as opposed to focusing on just equipment and the risks that model creates in terms of long-term continuous access to care. So this is about resilience. It's about education. It brings in climate adaptation into a replicable and scalable model. And so what we would like for commissioners to think about is the financing architectures that really made this possible. The model shows that it is possible to channel capital, not just to build something, but to ensure you have an ecosystem and infrastructure as a service approach that fits into local corporate business models and cultures, and actually serves as an enhancement to the companies that are leading the charge. Because if there's a synergy there, this will be a win-win, and we'll be able to scale this and continue to find other ways to suit the health access needs and quality of health care for these communities. So it's a small program, but scaling to 10 countries and causing a lot of excitement in terms of the ability to use public-private partnerships to catalyze and then grow into a more private sector dominated approach that can scale.
Nancy, thank you so much actually for sharing this. And I think that, the example that you're shedding light on is extremely important, obviously, as we discuss quality of care, as we discuss, how do we ensure, obviously, that there are no disruptions in service provision, particularly in those countries, where many health facilities are lacking access to electricity. And even in most cases, there is unreliable electricity sources. So I think the energy as a service model that you've presented, and it's something obviously that we're also supportive of in the World Bank, is most certainly the way to go. And thinking about the PPP model that that would be set up around that would be obviously one of the main steps that we need to take forward. So thanks again for sharing that, Nancy. So I'm gonna now turn to our last panelist, last but not least, and we're gonna be closing this lightning round by listening to Vera Songwe. She's the chair and founder of the Liquidity and Sustainable Facility, a mechanism designed to improve liquidity in African sovereign bond markets and incentivize sustainability-related investments across the African continent. Vera, over to you.
Thank you. Thank you very much. Can you hear me?
Loud and clear.
Okay, fantastic. No, thanks. And thanks for all the really great presentations. I wanted to start a little bit, maybe I'll take you just a step back. I'm also here because I co-chair the high-level expert group on climate finance. And part of what we've been doing a lot of is just talking about where we are globally with climate finance. And the reason why I want to do that is really because we've spoken a lot in this session, and really thank you very much to the National Association of Medicine for having me here. We are beginning to push a little bit the conversation that says when we talk about climate finance, we should also talk about development, because in some sense, climate finance is about the whole development conversation, and the whole development conversation is also about health. And as we know, and you know most of this a lot better than me, sometimes actually to improve health outcomes, we need to fix a road, right? And so while we do want a lot of the resources also to go to health, and we want to target some of the health interventions, we do also want generally for climate finance to go, for more development finance to go for climate finance. And I think one of the messages that we continue to send is that climate finance is development finance and will help health and gender and everything else. The good news is that the resources that are going to climate finance so far have been increasing. We see right now about $1.9 trillion, latest numbers in 2023. We'll update that hopefully in the next few months, but it still falls far short of what we need, right? We need about $6.3 trillion to get into climate finance. A lot of it is going to the emerging market and developing countries, mostly China, but a lot more needs to go to Latin America and Africa in terms of climate finance. So there's a lot of work that needs to be done in health, but in everything else to focus on climate finance. Of course, the last COP talked about the national quantitative goals that needed to be set, which was resetting a little bit the Paris agenda. Where are we with that? We have met the 100 billion, of course, in terms of financing. But as we know, we met the 100 billion, almost 8 years late. The less we spend on climate finance today, the more we're going to need to spend in the future, whether it's on health, whether it's on education. I think we saw the numbers of 4 billion people, at least on the continent of Africa, according to WHO, are directly affected. Their health is directly affected by climate finance. These numbers are increasing exponentially. The less we do, the more people suffer. 89 million people on the African continent today are either suffering from droughts or floods, which end up with malaria, dengue fever, or something or the other, which is quite important. So we do need to find financing pathways. I think Martin talked a lot about how you begin to put in place the different pockets of financing. But where are those pockets going to? And this slide just gives you a sense, a little bit of the big quantum that is needed. We need about $8 trillion to finance the SDGs, which is essentially development, of which part is climate and nature. And it's very important for us to talk about nature because there's a whole component there of nature and biodiversity, which is important, not just for health, but it is important for the drugs that we need to make to sort of cure ourselves. If we waste our biodiversity on the African continent today, 60% of our biodiversity is at risk because of climate finance. Take an example of Kenya, where a lot of the penicillins, the antibiotics of the world, actually come from raw materials from Kenya. If Kenya continues to suffer drought and floods, then we will begin to see shortages in the market, or even, and we're beginning to already witness resistance. And I think Tamer and the rest know this about sort of all the resistant antibiotics that we have now and the problems that you need. If you take the 8.6 trillion number, where is that going? 5.3 is going to the SDGs, of which 3 is going for climate. Climate is the energy transition. We've just talked about the fantastic presentation from Nancy. You need energy for health. It's on adaptation and resilience. I just talked about what is happening in Kenya and how we need to continue to make sure that the planting season works, not just for food, which causes malnutrition, but also so that we can actually grow and plant the drugs that we're going to need. It's for coping for loss and damage. And I think that Martin also talked about just the psychological impact. This is really heavy in Latin America, in particular in cities, when you have disasters. And then, of course, the just transition and energy. So there's a whole, if you look at this whole spectrum, at every node of this, there is a health impact, there is an associated health problem. How can we find the resources that we need? And this is a little bit what Martin talked about in terms of the capital stack. This is a little bit going from the 3.2 trillion into how do you sort of split it open? You split it open by saying 1.9 trillion is going to come from domestic resource mobilization. Countries themselves need to raise the resources. and then you get external financings, countries and or private finance. Nancy just talked about Strive supporting the initiative that she launched. I think Martin also talked about the private sector in Indonesia doing this. And so about 650, but it means that for us to get to where we need to get to today, we're going to need public finance, which means domestic resource mobilization, to increase by about 4.2, private finance to increase by 9.3. These numbers are quite high. On the external financing side, which is where the World Bank comes in, we need the multilateral development banks to increase their funding to climate by about 3.8 times. Now it's at about 300 billion. We need that number to go up to somewhere in the trillion. Bilateral financing, South-South cooperation, and other concessional financing. All of this need to increase. And I just want to give you a short example, and it's a very nice link to where Nancy and Martin talked about during the COVID crisis. Strive Masiwia, myself, John Kengasong, and Afri-Exim Bank. And so John Kengasong was the head of Africa CDC. I was working at the time at the Economic Commission for Africa. Afri-Exim Bank is a development bank on the continent, and Strive is a private sector person. We came together and we were able to use the SDRs, which had been given to countries. So we went to countries and we said to them, can we have some of your SDRs? They gave us about $1 billion of their SDRs. We were able to take those SDRs, which was very cheap, concessional almost resources, leverage it with Afri-Exim Bank, and essentially raised $2.2 billion. With that $2.2 billion, we were able to now go to the market. And if you remember, Africa was not getting access to COVID vaccines because nobody was willing to give us. We were waiting for COVAX to come. And if we had waited for COVAX to come, many Africans would have passed away, including the Caribbean. And this is a nice story that not many people know. The Caribbean countries could not have access to health, to the COVID vaccines because they were too small and nobody was willing to sell to them. It was the Japanese, the Olympics, and nobody could go to Japan if they didn't have vaccines. So we added the Caribbean countries to the African demand, and we made them sort of our 55th country or a 55th state. And so we were able to procure vaccines. We were able to stand in line and buy vaccines out of Johnson & Johnson. And so the first vaccines that were delivered actually went to the Caribbean so they could go out. But this is, again, bringing a capital stack that has the SDRs, which are and my ask now is that even the medical community, sometimes when we talk about raising resources and we talk about the special drawing rights, I think many people think this is just in the spirit or in the place of the economists, but it was so important for Africa at the time of COVID that I'm asking that the Commission, talks to Congress and all of that to reissue SDRs for climate today, because the climate crisis is probably more important and probably going to be more deadly. Maybe it's a slow kill, but the kill of this climate crisis is just as important as the COVID crisis. And the SDRs, the special drawing rights, was so critical in providing that very sort of cheap layer of financing that we were able to use, complement it now with development financing from the Afri-Exim Bank. Much later, we actually worked with the World Bank and Axel van Trossenberg and the health team to then help bring in a lot more de-risk financing, cheaper concessional financing to provide a lot more COVID vaccines onto the continent. I think it's this kind of association of the private sector with Strive. Working with Strive, we built something called the African Vaccine Platform, where people could go with transparency and buy the COVID vaccines. And in some sense, you build the procurement, you fix the procurement process, you bring in the private sector, and you bring in concessional financing that helps to deliver the health outcomes in a way that works. This is what we need for climate as well. We need this stack of concessional financing. I think, as Sarah Jane said, a lot of the developing countries today are in a very stressful financial situation. Everybody is in a stressful financial situation. The United States, France, everybody. I think the rest of the world, there's not enough fiscal space to handle and tackle the climate crisis. So we do need additional resources. Countries are going to work, yes, on domestic resource mobilization, but to be able to transition to a net zero economy, we're going to need additional resources from the private sector, but most importantly, cheaper concessional money from the World Bank, from the other multilateral institutions. But we also have something called the special drawing rights, which the IMF can release every 3 years, which essentially can go into the economic system to tackle issues of health, climate, and economic growth. Thank you very much.
Vera, this was great. Thank you so much for these remarks and reflections. And thanks for reminding us that we need to move from the 100 billion to the 1.3 trillion. And I think this is, again, it speaks to what we've been hearing, from Martin's presentation also at the beginning. Also, it's important to perhaps also shed light on the fact that this is not just a DFI issue, but it's also about ensuring that governments are very much a part of this, bringing in, domestic resource mobilization in the picture, and as you've said, increasing even by 4 times what currently, governments are allocating, towards climate, finance is critical. But the last point, perhaps before we move on to, onto a moderated session to all of our panelists, is also the huge role for the private sector. And the fact that, we need to be sort of scaling up private sector finance going into climate and health action by 21 times. That's an eye opener. So with that, we're going to move now into the next part of today's session, which is a moderated discussion. I'll be asking each of our panelists a question, and please feel free to put your questions also in the chat, so I could bring those up to our panelists. I'm going to start off with you, Martin, because there was actually 2 questions in the chat that came up earlier while you were speaking. And the first one had to do with the numbers that you presented. How much of those were pledged versus how much of those were actually spent resources? So that's one part, of the question. And then the second part, which I'm happy also assisting you in responding to that, is how do we account for climate and health finance in specific, trying to sort of tease out, if you will, how much climate and health finance is going within an overall, let's say, budget envelope for health financing in general. So Martin, over to you.
Yeah, thanks, Tamer. So the estimates that we saw in the SEEK analysis are based on dispersals. So they were looking at actual money that was spent by the various financing institutions. I talked about the many ways that I think it overestimates the total amount of climate health adaptation financing. And that really gets to the second question. How do you define climate and health financing? How do you define something that, there are lots of diseases, I've worked on malaria for 20 years, that existed before climate change, had a massive burden before climate change. And then there's a portion of the risk and burden, flooding risk, expansion to new latitudes and altitudes of the vector and so forth, that are attributable to climate change. And so it becomes a really subtle art to try to define what funding goes to kind of conventional weather-related and climate-sensitive disease, and what portion of burden and spend is attributable to climate change. I know that's something that the MDBs have done with real precision, and of course I was honored to work with you, Tamer, and the 14 MDBs on the climate and health roadmap. So I think I heard you ask yourself this question, so why don't I throw it to you to answer?
Yeah, no, I think it's a very pertinent question, because I think we need to keep ourselves accountable, and we need to be able to say that, everything that we do is going to increase, obviously, the resilience of health systems, but it doesn't mean that everything we're putting money in is necessarily specifically climate and health. It could be just a no regrets sort of approach, in financing or investing in certain things. So I think this is about the incrementality. This is about what is it that we're doing, above and beyond what we're currently doing to be able to address the climate crisis. This is about ensuring that we're putting this within the vulnerability context. Yeah, understanding, country vulnerabilities, understanding obviously who's being impacted, and within that context, bringing in many of the examples that we've heard today, be it the example that Nancy brought up, around, for example, access to electricity. And that's, that's something obviously quite big, for us to talk about, all the the Wolbachia example that you came up with. So the joint multilateral development banks methodology is actually getting us into being able to sort of distill, if you will, how much of our overall funding is going towards climate and health specifically. Sara, let me move over to you. And I have a question for you on how can we design financing mechanisms and policy frameworks that bring resources closer to countries, empowering them to lead and scale their own climate health investment priorities. Sara.
Thank you for the question. So one is, I think we heard from Vera, one very clear solution using the SDRs. I think other sort of opportunities to consider is around the debt for resilience swaps. We're seeing these as a way to free up some fiscal space to then sort of repurpose towards perhaps health and climate outcomes. The other point is on the slide that Vera also shared around country platforms. We're seeing that as a way for countries to be very clear and decisive with what they would like to see, and that they could then figure innovative procurement strategies focusing on impact more so. Just this week, actually, in the Philippines, the Department of Energy, along with the Department of Health, have put out a call for a procurement order for all the rooftops in isolated island grids that have health hospitals and Department of Health buildings to have solar. So we're definitely seeing this in real time. The other point is that I mentioned earlier, looking at low-tech, high-impact procurement. Like this is something that we need to also consider, just due to the fiscal space issues, but that we're at a point where the poor and vulnerable populations in our countries are paying the brunt of it. It's probably not calculated in terms of their losses just because their income levels are low, but it is disrupting their lives and livelihoods, especially school children and hospitals. And so if there were ways that we could prioritize this sort of tech transfer, it's likely South-South tech transfer. I think that would be another sort of opportunity to support climate vulnerable countries. Yeah.
No, this is great, Sara. And just to keep this, more conversational, Vera, I just wanted to see if you wanted to perhaps, add further to what Sara was saying, particularly in relation to the SDRs and the debt, for resilience swaps.
No, thank you. I think on the SDRs, so I'm a broken record on the SDRs, but I think that the SDRs, again, for many people who are listening to us and who don't, the special drawing rights, the IMF, the International Monetary Fund, has in its sort of charters of agreement that every year when there is a systemic global crisis, they can release resources into the global economy, which will help people act as a little bit as a cushion, either to prepare for the crisis or a post-crisis to respond to the crisis. It has been done 3 times, one in 1973 during the oil crisis, one in 2008 during the global financial crisis when Europe needed resources to sort of stop the bleeding after the global financial crisis, and then one after the COVID crisis, $650 billion was released. A big chunk of these resources go to the advanced economies because it is sort of released by what we call the quarters of the World Bank. But in Africa, for example, we got 37 billion. I just give you an example of how we were able to use some of the resources that went to these countries to be able to leverage additional resources and buy $2.2 billion worth of COVID vaccines. But these crowds in the private sector, it brings in, we've been talking about the need not only to find the medication, but also, and I think, Tamer, we've all worked on this, we need to put factories in these countries. In the United States, they were talking about tariffs because Americans want to produce the pharmaceutical products. Africans want to. Today, 90% of our drugs are coming from outside. Almost 100% of our vaccines are coming, are bringing under the COVAX. Senegal is already producing vaccines. Cameroon is producing vaccines. Kenya is producing vaccines. There's a couple of countries we need to scale that. South Africa, of course, is producing a lot of vaccines that is export. I think we need to be able to begin to produce on the continent. For that, you need need to build the private sector. You need to generate electricity, stable energy flows, maybe battery energy storage, maybe small modular nuclear reactors. It is this convergence of all these things that, we need to produce. But for that, we need, I think, as Sara just said, cost of capital needs to be small right now. The yields on African spreads are quite high. We have one of the highest, actually, we have the highest, 450 basis points on average compared to about 130 in Asia or 250 in Latin America in terms of borrowing cost. We cannot afford it. We're the most hit. 4% of climate comes from Africa. We actually do have the climate sinks, but we are actually suffering the most. The only way that we can begin to build resilience is that we get cheaper capital. Maybe it's debt for climate swaps. Maybe it's debt for development swaps, which then work on sort of a global development program that also includes health and energy and girls schooling. Actually, one of the best ways to work on health is to send girls to school. And so, we can begin to look at some of that and see how we can actually push those agendas forward with these kinds of instruments. Cote d'Ivoire, with the World Bank, has just done a debt for development swap, which has education as part of the underpinning. And I'm sure that if we looked in a few years forward, we would see that it had good impacts on health outcomes as well.
No, I mean, this is fantastic. I mean, you brought up a lot of, very interesting points in your interjection now. And one of those is on local manufacturing. And I think it's something that we have to take into account as we think about the drugs and vaccines, for example, that are needed, and how we could build capacity, if you will, in the African continent and in other regions to ensure that there is local manufacturing capacity. And obviously the role of the private sector is going to be huge in that regard. So let me just bring in Nancy into the discussion, given that we're now also talking about the role of the private sector. I mean, something like local manufacturing, Nancy, how do you see the private sector coming into this, playing a role in sort of scaling up action, if you will, within a continental, let's say, discourse?
Sure, it's a great question, and I'm just really thankful for the elucidation that everyone's providing here on that issue. I think that one of the, stepping just back a little bit, why isn't there more local private sector involvement is kind of the broader question in products or services that lead to better health. I think there are a few barriers that we face, and there are ways, and many of the discussions today are pointing in the direction towards solutions. I mean, for one, there is a bit of a silo, at least in the investment world. There are the healthcare investors, there are the climate investors. And while we have a very targeted approach in terms of impact, and we link the two, and others do, it's those pools of capital are often very separate. And the innovation cycles don't inform one the other. So I do think that anything we can do to to get rid of the silos is going to help us look at things like the impact of economic development on climate and health issues, because that's where jobs and local manufacturing or local private sector activity come in. And one of the reasons that we like the blended approach to financing is that it does, when you do have local participation, it does bring up a lot of the externalities that are usually not factored in. The indirect costs of climate actions, health benefits, job creation, those are not getting monetized usually. But when you do, for example, we have an afforestation company that is in the rural areas of Arkansas where jobs are scarce, lower income populations, rural issues. By joining forces with the giant JP Morgan on one hand to finance the purchase of all those trees to plant, which is expensive. Join that with Microsoft, who's going to who's the off-taker, who's going to get the carbon credits. That's fantastic. That's a new model that's going to have benefits in that Arkansas community or in rural communities in general. But you really do need the economic development piece. You need to look at how do you monetize the benefits of better biodiversity that trees planted in a region create, better water quality, better air quality, the recreational opportunities, the mental health benefits of a more resilient and thriving natural environment. When you just look at carbon on the climate side or health outcomes on the medical side, you're not capturing the full picture. And I do think that economic development, the role that local private sector activity can play in improving the lives and the job creation opportunities, is a very potent weapon that we don't use enough. And so what I would like to see is that we talk more about monetizing the co-benefits, because without that, you're leaving out some key constituents. And so we shouldn't just talk about carbon offtake when we plant trees, be they in Latin America or the southern US. We should talk about the biodiversity benefits. We should talk about the job creation, the mental health benefits, the air and water quality. And that just attracts a larger pool of both private sector and not-for-profit to the point of ClimateWorks. I mean, these are the kinds of problems that people really want to solve, and a little bit of commingling and blended approach, as well as pricing in the externalities, I think will go a long way to bringing more local participation in, be they health product markets or climate markets.
Nancy, this is great, and please hold on to these ideas that you've just brought up, because I'm going to come back to you, particularly on the need to sort of monetize these broader impacts from climate. But let me shift gears, and we've heard a lot about the role of philanthropy, and Jess, I want to come over to you, and really to see if we could push a little bit more on how you think the philanthropic organizations can play a role in leveraging innovative financing solutions. We've heard about blended finance. What other solutions do you have in mind? Impact bonds, capital market instruments, to scale up, for example, climate and health investments. How can you take us to move in that direction where we actually can bring in more of philanthropic financing into this space?
Yeah, thanks for the question. I think there's many different approaches that we can take to really find solutions for blending finance. I don't think there's sort of a one-size-fits-all model. For philanthropy, I think it's often doing the startup work to get the gears moving, whether it's sort of piloting a new approach, doing the background research, or modeling to demonstrate that there is a viable business opportunity. I think occasionally there are opportunities for direct blending in terms of actually investing philanthropic capital into a capital stack. I think some of the ways that we're seeing where we can play a key role is, so for example, there's an adaptation funding window that was established by USAID. Some of that. So the purpose was really to get funding for adaptation investments in sub-Saharan Africa. And the point was for USAID to do some of the initial groundwork to create a pipeline of projects that then would go on to bilateral development finance institutions. Obviously, with the shuttering of USAID, that ability to create the pipeline has been diminished. So we are stepping in as a philanthropic organization to help create that pipeline, which then leads to the investments from the development finance institution. So a small amount of investment from philanthropy can really help unlock and catalyze that development finance institution investment. As I mentioned, we're also doing some piloting with different community-based parametric insurance models. We're also supporting some blended finance through venture building also in Africa. So this is really to help the establishment of new ventures. So for example, one thing that we're supporting is a new manufacturing approach for heat and pollutant sensors to ensure the safety of workers in heat-sensitive industries, protecting workers from pollutants that are amplified by heat. These are really profit-oriented projects, but it often takes a little bit of catalytic investment to get the ventures going. So those are just a couple examples.
And these are great examples. And I think, the parametric insurance in particular, I think is one area that we need to dig a little bit deeper into. As you've said, I've heard it actually from a number of different, let's say, players in the space. Prudential, for example, Mercer, others are already looking into how they could be scaling up parametric insurance. So we may come back to this in just a moment. Just to let everybody know that we're taking note of all the questions that are coming in online, and once we're done with this part of the session, we're going to come to those questions. But let me go back to you again, Vera. From your experience working across public, multilateral, market-facing institutions, what would it take to truly align global financial governance with the real investment needs of countries so that capital from all sources can be coordinated and deployed at the scale needed for integrated climate health action?
That's a big question. No, I think one, it would take alignment of interest. That's a short answer to a very, and what do I mean by alignment of interest? And I think just to sort of throw a wrench in the conversation, we've talked a lot about blended finance, but there is a little bit of we need to be careful, right? Because sometimes blending does not necessarily put the risk where the sort of origination of the risk lies. And we end up with many countries paying for risk or paying for guarantees. I was just talking yesterday with the Brazilian National Development Bank, and I was saying, why don't you take more guarantees, which is blending, by the way. Blending means you are reducing the cost of capital for a private sector who is coming in. But sometimes the private sector inflates the cost. And so it's even more expensive for the public sector to pay down, what is already an inflated cost because we don't do enough work. And so one of the things we do need to do a lot more of, to answer your question, what would it take, is we as the public sector, particularly institutions like yours, really need to work with governments to make sure that we're identifying the risk, so that when we decide to bring in philanthropy or cheaper financing, that we are essentially targeting the place that is the most important. The other thing that I've done, and I do a lot of work on this, is on the prudential regulations, the global I talked about 2008 and the crisis, post the crisis. There was a lot of work that was done by the Basel Committee to sort of see how one could tighten regulation so that we didn't have a lot of derivative products that were created and cause another crisis. It has worked extremely well. We don't have a crisis. But one of the things that we suffer from, for example, is when you do an investment, an infrastructure investment, the most risky part of the investment is the first few years, right? It's the time to build, it's the certificates you need and all of that. And for that, you need some capital requirement, that is safe so that you don't go belly up. But after 5 years, when that whether it's a pharmaceutical company or an energy company, after 5 years, when you've done the initial building, the risk is lower, but countries are still holding capital. And so essentially we are sequestering capital from sort of other development needs because we're sort of putting it away in terms of for risk that will never materialize because you've passed that risk. And so I think there is sort of the global regulatory environment around credit rating agencies, around export credit agreements, a lot of these things that we do. We work with capital that we need from abroad. We are going to need debt. Debt is important. Let me say this. It's very important that we are clear about it. Developing countries are always going to need debt. We cannot grow even if we raise all the resources in-house. We're still going to need to raise some capital. We love the World Bank and concessional institutions because the resources are cheaper. We can bet, but then you have a constrained envelope. So we do need to go to the market. We do need to go to the private sector. And so essentially what we need is that the private sector approximate your cost. They cannot exactly be you because you're funded by states and you have a AAA rating. The private sector is mostly BBB and or single. And so they're giving us their capital. but that capital should be cheaper than what we afford today. And I think a lot more work needs to be done in the prudential space to lower the cost of capital. But most importantly, in this blended space, we need to make sure that we're blending in the right places. There's a lot of blending happening today, credit enhancements, but we're not enhancing the right credit at the right time. And I think some work needs to be done in that space, and institutions like the World Bank, I think, are really well placed to do that.
Thanks so much for that interjection, Vera. Sara, let me go over to you, and I want to ask this question, and I'm going to actually even pose that question to all of the other panelists, but I want to start with you. What do you think is one structure or institutional change that you believe would enable and accelerate more integrated long-term climate and health investments? Do you want me to repeat the question again?
Yes, please. Sorry, it's late over here.
Oh, I'm so sorry about that. So I'm just looking for, in your view, one structural or institutional change that you believe would really make the difference in pushing forward climate and health investments.
Yeah. Okay, great. Thank you. I think one thing is just really around, besides this cost of capital, it is that the risk sharing component, but just on the cost of capital, but just staying there, we do find, I'm just trying to actually find the slides, but I can't. Yeah, there it is. So we do find that low middle income countries, for example, the sort of perceived risk versus the actual risk, the difference of that is 10% according to GEMS. And then for low income country, there's a variance of about 12% or more. So it's quite huge in terms of the variance of this perceived risk. So if we could find like a fund or something that could basically illustrate the true risk of the projects and of the countries, basically be that market signal or support with really verifying the true cost or let's say the true risk premium. I think that would also be quite useful. That could be a new institution. It could be a group of institutions that support that effort.
Thank you, Sara. Martin, what are your views on what Sara just talked about, a new fund or a new institution?
Yeah. It's also late here, so a little fuzzy brain. Sara, I'm sympathetic to your plight. I don't know if we need a new fund or institution. I think there's a lot of inertia against trying to do that. We have a lot of money in the system. We have a lot of existing and sophisticated institutions, and so finding ways for them to, work together is hard work. But the money's already there. A lot of the infrastructure's already there. I think there's a lot more we can be doing. Tamer, I know we've spent a lot of time trying to work between the World Bank, the Green Climate Fund, the Global Fund, for instance, respectively, the largest funders of climate, multilateral, health multilateral, and of course, the World Bank is the largest of the multilateral development banks. And so, if we can do it there, then there's a lot to be gained, a lot of efficiency to be found between those institutions. One other thing I just wanted to share as we talk about kind of structural solutions is I do think there's more that can be done creatively around market shaping. And kind of using risk capital to shape markets in a way that produce the big outcomes that we want to. And one example that I've been intrigued by, and I haven't seen it done at scale yet, is thinking about space cooling, clean cooling, AC units, particularly as you see heat stress growing all around the world. But South Asia leaps to mind as one epicenter. There are estimates that the world is going to buy 3 billion home AC units between now and 2050. India is going to buy 1 billion of those units. A lot of the AC units sold in low-income settings or emerging markets are the worst. They're not energy efficient. They're extremely polluting, and yet there are real innovations that we've seen around 5x as energy efficient and kind of low emitting units. And so how can we think creatively with our catalytic capital about doing the market shaping to bring the cost down, to make those kinds of innovations accessible, as while we're still at the low end of this kind of growth curve of purchasing around, say, clean AC units. So, those kinds of deals are hard and complex, and you need the right broker to help set up the pipeline and make them possible. But I think that's a public good that's missing at the moment. And I think there are a lot of positively inclined grant providers, philanthropies, catalytic capital providers that if deals like that were made available, would be really intrigued to try to achieve those gains.
Excellent. Thanks, Martin. We have like 2 more minutes, and I want to get to the questions that have been shared by the commissioners online. But Nancy, I want to end, perhaps, with this question to you. We've heard Martin now speak about market shaping. So one question really is the incentive systems for the private sector to be really coming in and scaling up finance and delivery. What do you see are some of the impediments, or what is that we need to be able to do to incentivize more private sector financing in climate and health action?
Well, I do think you have to have a longer term view, because this is hard. It doesn't happen as quickly as it does in U.S. markets, because we don't need to go into the why of that. But as we develop these successes, and while Zola is still in the early days, the ability to scale from Tanzania to 10 other countries and replace not-for-profit money with private sector investment, I think we need to spread the word, and we need to do more of that, and we need to bring these worlds together so that we properly value all the benefits, because it just feels to me that sometimes the climate benefits are separated from the health benefits too much, and that if we can work together and develop more successes, or have people fund, after 10 countries with Zola, let's do another 10 and bring in new players. Total is a group that's interested in this on the private sector side. So I think we should be more intentional about corralling the institutional dollars or capital that we have to bring to bear on a more a solution that addresses the public health emergency, the health emergencies with the climate damage. And we just haven't seen that. We always feel that some of the mental health gains, the economic development, the job creation, the avoided disease, sometimes those are just treated as nice to haves. And that really needs to stop, because it's not just a cost issue, although the costs, as we've heard, are extraordinary. It's a thriving in the 21st century issue, because if we don't address the climate challenge with the public health emergency that is exacerbated by climate, many other social institutions and guardrails will fall away. So I do think that shouting about our successes, investing in them so that they grow bigger, and then that draws in more players, healthcare people, climate people, when they see that actually something is working in a historically very difficult region, that will turn a lot of tides. That will enable people to be confident.
Well, that's a great response, Nancy. Thanks so much for sharing it. So I'm shifting to the questions that we've received online, and Vera, I'm going to come to you with the first question. We've been talking about funding, and in some sense, it actually came up quite a bit. Some separation between adaptation funds versus mitigation funds, and the question really is coming up saying, listen, can we shift the narrative to a public health model instead of climate. That is mitigation and upstream primary prevention. Shouldn't we work hard to show that energy and health policies are one and the same? Well, I mean, but really getting to you, Vera, how do you see the sort of the adaptation, mitigation, separation of funding, or if this should be more of a holistic sort of funding discourse?
I mean, I have a paper that I wrote on sort of trying to urge people to have it as a whole of funding conversation. And very importantly, that's an important question. I think that we've sort of pushed ourselves into a little bit of a box, because we started by saying, oh, mitigation is private sector friendly and we can, calculate the IRRs and all of that. And so the private sector and everybody went to mitigation and nobody went to adaptation. But building a resilient house is adaptation, right? And we saw during the fires in California that the only houses that stood were the ones that were built with climate resilient technology. And so essentially that is, yes, adaptation, but it is also good business. So it is mitigation as well. And when you think about Africa, where we're going to be creating, I don't know, is it 70 cities every year on the continent? We do want to build resistant housing for the floods and for the heat. And Martin just talked about air conditioning. We can do different, we can do better, we can learn from the Philippines. So yes, maybe there's some areas which is sort of intrinsically adaptation prone, but we also know that even energy is an adaptation investment, right? Today we talk about it a lot in the mitigation space because we know how to calculate the IRRs and we can bring in the IPPs and we can do the generation and the distribution eventually as we go forward. But we should be able to do that in any country. In many of the African countries, we are still trying to get to 100% access. And so essentially, that is also an important part. It's even more important because it helps us to protect nature. I think that where it is really becoming important is where we value nature as an asset, right? And we have not put enough value onto nature. And so there's a lot of conversations around nature as adaptation because we don't know how to value a forest. We don't know how to value the oceans around Seychelles or all of West Africa, the 23 countries that provide fish for the women whose livelihood it is to fish. And so I think we do need to do a little bit more work on valuation. The more we do work on valuation, the more we begin to realize that mitigation, adaptation are essentially the same things. Where there is a difference is, and I take the example maybe of Senegal and the wall, right? The wall which stops the ocean from coming in. I don't know I think in those cases where you need public goods, and maybe this is where the distinction should come from, rather than mitigation and adaptation, is what is a public good and what's a private good. If it's a wall embankment to protect water from coming in, then that's clearly a public good, but there is private benefit and we can actually cost it, right? All the hotels around the Senegal beach, each hotel can contribute some, but the state needs to do that investment because it cannot be done by the public sector, and one needs to put, and I think that's where maybe we do need to do a slight steer away from just saying this is adaptation, this is mitigation. Adaptation needs public funding, mitigation can go with the private sector. We do need to mix them and find collective funding to do some of these things.
No, this is great, Vera, and I think it also, if we try and broaden even the discussion further, I'm looking at a comment that, that has been put in the chat by Andy Haynes, where he's saying that, we also need to be able to take into account that the benefits of climate action, they go well beyond just health, yeah? And I think this speaks to, what we've mentioned before, and I think, Nancy, you were the one that was talking about jobs, you were talking about human capital development, and really trying to broaden sort of our understanding that when we do sort of climate action, it's good development in general. Yeah, so this is not just because we're trying to address one specific area, but how is it that, through climate action, climate and health, we're able to address a full range of different things that's not just focused on health, and therefore obviously bringing in the adaptation, mitigation mix to that is extremely important. So I have one last question because we're just about at time now, and I just want to be able to come back to you, Sara, with this question, and it's actually about you spoke about it at the beginning, and it's all about the sort of the debt that the South, the global South, is incurring. So how do you see us moving, around this agenda, and how can we bring in more of the, let's say, the catalytic funding and some of the instruments that, that Martin was speaking about, including buy downs, for example, to sort of, offset, if you will, some of the debt that, the global south is facing?
Thank you. Sorry, just to clarify, do you mean debt for climate swaps when you say offsets?
Yes.
Okay, yeah. Yes, so I think one is certainly debt for climate swaps. Another sort of maybe two or three things to help with is looking at finding ways to perhaps extend the debt repayment terms to 40 years, for example, and obviously lowering interest rates, specifically MDBs, as we all know, should be providing this concessional capital, but in particular for climate vulnerable, low middle income countries, it's quite challenging for them to get that lower cost of capital from the IBRD, from MDBs. And so if it was feasible to have cost of capital priced below the country's medium-term growth rate, that would be very useful to deal as well with our debt issues, because it's not actually a debt to GDP issue as well. It's really just the servicing cost. That's the issue, which means longer tenors, lower cost of capitals, and MDBs are, as mentioned by the philanthropic partner, philanthropy is limited in what they can do, and MDBs is really where we can support, I guess, this climate vulnerable developing countries, and also the fact that I don't think they're facing budget cuts the way bilaterals and other groups are. So.
Thank you, Sara. So we're at time. I just wanted to thank our distinguished panelists for joining us today. I mean, this has been a very rich discussion. In like 30, 40 seconds, if Michelle, if you allow me to do that, I just want to be able to capture a few of the main messages that came out through today's discussion. And I just want to remind everyone that at the end of the day, what we're discussing is obviously people. The impacts, the climate impacts, on people. And so there's a huge equity dimension to what we have discussed today. Martin, at the very beginning, reminded us of the huge cost of inaction. And from there, we talked about, sort of the amount of funding and financing that's going for climate in general, but specifically also for climate and health action. And he left us with the point that we should not forget this figure, that $11 billion per year in low and middle income countries are needed for adaptation. We also, have heard quite a bit, through the discussion that development assistance for health has been shrinking. There are huge fiscal pressures on governments, and that solutions exists, and that these solutions really come through the whole notion around blended finance, including obviously domestic resource mobilization, concessional financing, commercial investments, as well as catalytic grant capitals. And through today's discussion, it was very clear that there were a number of solutions that were put out there as examples, and we've been able to really look at those examples and how they've been working, how we're bringing in the private sector also in this space, so that that there is a huge scale up in terms of what we do. Energy as a service was brought in as one example. Wallachia was another example, and of course so many others that came out in the conversation. Let's not forget that, as we were reminded today, this is about moving from the $100 billion to the $1.3 trillion that are needed to be able to scale up. It has to be about governments, and we need to be able to work with governments on domestic resource mobilization. We also need to work with the extended financing sort of group that includes the development banks as well as the private sector and others to increase financing and scale up financing for climate and health. My very final point before I pass it now back to Michelle is that, as we've heard from our panelists today, this is not just the impacts on health. This is a much broader agenda. This is an agenda that also extends into us thinking about people's livelihoods, jobs, human capital, education. So the impacts and the benefits, if you will, from scaling up climate and health action will most certainly be far more than just the focus on health. with that, I want to thank everybody very much for contributing to today's discussion, and I'm passing it back to you, Michelle.
Thanks so much, Tamer, for leading a really rich and quite wide-ranging discussion. We're certainly wrapping up today's session on a high note. On behalf of the National Academy of Medicine and the Commission, I would like to express our gratitude to all of today's speakers. Your thoughtful contributions will undoubtedly inform our work moving forward. And for those of you following along on the live stream, please join us again tomorrow, Wednesday, August 6th, for the third and final day of this workshop, as we continue to examine how to reorient systems to protect people and the planet. So thank you all, and we will see you again soon.